All right, well, the measles outbreak, to our big story right now, right? The deep dive is growing in Texas. State health services reported 124 cases since late January. Now, most of them are in Gaines County in West Texas, mostly impacting young, unvaccinated people. 119 cases are in unvaccinated or unknown vaccination status people. No cases have been reported in Central Texas, but Hays County health officials have warned of a possible exposure. As we told you earlier, a person who tested positive visited San Marcos on Valentine's Day and the next day as well, ate at several restaurants, went to Buc-ee's, went to Twin Peaks, went to all these popular places. So if you were in those areas, check out yourself, make sure you're okay. Now, the best way to prevent getting sick is to get 2 doses, doctors say, of the measles, mumps, and rubella vaccine, MMR. If you think you've been exposed, contact your local health department for further instructions. Do not leave your home if you have symptoms. Stay home. Don't go to the doctor. Don't go to the hospital. It is very contagious. Call a health care provider immediately. Avoid exposing others near you. Again, the best way to avoid it, doctors say, the MMR vaccine. They say 90% of those who are not vaccinated or who have not had a previous measles infection will become infected. 90%. Well, I sat down with the local infectious disease expert at Dell Medical School, Dr. Rama Thiagarajan.
So the State Health Department of Texas has actually, as of today, I think they just released the latest case count, has about 124 cases of measles as part of an outbreak, predominantly in Gaines County. But if you look at the state health website and their cases, there have been other cases in other counties as well.
How serious is measles? Because it's something that we grew up not even having to worry about because of the vaccine.
Yeah, certainly. Yeah. So for most people, I think measles is a clinical illness where generally affecting younger people, children or kids in school, grade school. And it's a respiratory illness. It starts as a respiratory illness, and people have a runny nose or a little bit of cough or watering of the eye. They may have a spot or two in their mouth, and then it starts as a rash that starts from the head and then kind of spreads down. For majority of people, it's a mild illness that will take you out of school, obviously, or work because it's very contagious. You will not be allowed to. I would say it's about a 7 to 10 day illness, but it is not uncommon for people to have a serious, like a pneumonia, serious respiratory infection, or inflammation of the brain. So this happens in about 1 to 2 cases per 1,000. So I would say it's not very common, but it can happen and it's preventable.
Why is it that people are not taking the MMR vaccine or deciding to have their kids vaccinated? Have you seen that? And if so, why do you think that is?
I think Texas is one of the states where vaccination rates in school-age children is lower compared to the national average of about 92%. I think the rate in some counties are around 80%. And the reasons are many. I think there has been concerns. I think, as you know, with the COVID pandemic, there was a lot of pushback about vaccination. So that has something to do with it. I think the primary factor is that we live in a community with a lot of people who are vaccinated. So many of the folks who are making decisions about avoiding vaccines have not seen vaccine preventable illness and the benefits of vaccination. So I will go back and kind of give you an example of the scope or how big this problem was in around 1963, before the vaccine came out. I think I have some statistics here. There were on an average, about 3 to 4 million cases in the United States annually. About 500,000 were reported. Most people just took care of it. In one person in the household got it, especially a child. The entire, all the children got it. But there were about 500 deaths, about 50,000 hospitalizations, and about 1,000 of them developed serious brain swelling. So that's where we were, and with the benefit of vaccination, the MMR vaccine, 2 doses of vaccine, has a 97% protection against measles. So I think this may be the reason the younger generation or people that are not seeing these kind of illnesses question the value of vaccination. And there have been reports very early on. I would probably say in the 90s, and there was some association with autism or the spectrum disease ASD, but multiple studies subsequently have proved that this is not correct and vaccines are safe. So I think the public may have some concerns about the safety of the vaccine, but we know through many, many studies that vaccines are safe. They may have minor side effects, but they're very safe, and they are, especially for measles, more than 95% protects you against severe measles.
What about for the adults out there or immunocompromised people, and they don't know it's been so long since maybe they were or were not vaccinated? I'm 48. I'll just say I don't know what happened 40 some years ago. What do we need to worry about? Do we need to get booster shots? Do we need to search through our records?
Yeah, probably a little bit of everything. Yeah. So I think it's good for each of us to see where we are, right? What is our risk? When I say our, people in our family, our children, our elderly, just kind of assess what is our risk of getting measles. And part of it is because we may be in Gaines County. Gaines County is different than the counties that we're in. I live in Travis County. So we have to kind of see what is our risk. If there is a question, I think the best thing is to pull out your vaccination records. And I know that is not easy for several of us. It's not there handy. But if it's available, I think you need to make sure that you can get access to that and look. And if you've had 2 doses of vaccine, MMR vaccine, you don't need to worry about. You would be considered protective. Okay. If you have had 1 dose, and if you live in a county where there is measles cases, because we know this outbreak is going to grow. So if you live in a county where there's outbreak cases, definitely get yourself a second shot. If you do not know your vaccination status, I think we would recommend, especially if you're in a county where there is outbreak and there are a lot of cases, or your immune system is weak, that if you're going to get measles, and it's applicable adults too, people who have cancer, who take immune suppressive medications. And if you're not sure about your vaccination status, you definitely should be receiving 2 doses of MMR vaccine a month apart.
So there's no danger in getting another one now if you're not sure.
That's correct. It's very safe. Absolutely.
What you talked about, I think the math is 0.1% of the measles cases back in the day became serious. How does that compare to the flu or to COVID, things like that?
Again, I think you have to look at the population. I can't just talk about COVID, because COVID, the pandemic stretched on for several years, right? What we are seeing with COVID and deaths now is different than what we saw with COVID at the onset of the pandemic. So it's really hard to compare numbers. The same thing is true for influenza. Every year is different. The strains are different. And also population risk is different for different populations. So a 30-year-old is not the same as a 70-year-old who has weak immune system and is on cancer chemotherapy. Certainly, certain immunocompromised or immunosuppressed or people with weak immune systems cannot take this vaccine because it's what we call a live attenuated vaccine. But there are other treatments for them to prevent measles if they're exposed to a case. They can speak to the health department or their providers. They can get immune globulins. So I hope that answers your question.
Yeah. The last question I could think of is, what would you say to the moms and dads out there who I've talked to some of them who are scared to send their kids to school because it obviously is so, spreadable, so contagious? What would you say to them?
I would say look to see where you are. If you are in an outbreak county, or if you receive any communication from the public health department, the schools, definitely be on the lookout. But there is no reason for people to panic. really, as with it's a very contagious respiratory skin illness, but there is no reason if you have a healthy child and if your child has received 2 doses of vaccine, there is no reason to panic. Now, if the child is obviously, if you have a baby that's less than a year old, and if you live in a county where there's outbreak and you feel if the child goes to daycare, definitely think about getting your baby, 1 dose of MMR. 6 to 11 months of age is a recommendation given this outbreak setting. But again, your healthcare provider is the best person to answer all these questions. If you are also you're looking for guidance, certainly the Texas State Health Department has a lot of guidance that's applicable. The CDC also has a lot of resources that's available to the public that would be useful. I would say no, there is no need to panic.